So, as human beings, we have been evolved from a four-legged walking animal, so to a two-legged walking animal. So, because of this upright position which we human beings have attained, there are so many things, the diseases which have come in, starting from the sole to the head and neck. Like for example, the sole pain, heel pain, the knee pain, the lower back pain, upper back and the shoulder pain, and the activities that we do using our upper limb. So, we will have even the elbow pains. So, these pains are very commonly seen, almost if I just say in an orthopedic practice as an orthopedic surgeon. So, we see almost 60 to 70% of our disorders which the patients come in are related to this problem. Very few are diseases which are treatable or not treatable. So, we are going to discuss related to these common things, 9 to 11 problems which are commonly seen. Know what exactly it is in your own terminologies, which I will try to explain the way that you could understand the anatomy of it, physiology of it, and then try to modify and understand what exactly has happened and have a remedial measures. So, which could be of much help to you to in not only treating the problem, but also to prevent the problems from recurring or in a continuous manner. As a professional, I am an orthopedic surgeon. I am professor of orthopedics, reached this particular stage after many years. So, I completed my undergraduation from my Kasturba Medical College, Mangalore, post-graduation, a postgraduate diploma from my MR Medical College, Gulbarga, MS from JSS Medical College. I did national board examination, the diplomate of national board from the national board, and in between I had some problems which made me even to go into a specialty in-depth analysis or in-depth knowledge of the rheumatological disorders, which I am going to tell you why I came into this kind of analyzing or exploring the integration in the therapies. So, professionally I had well advanced or well oriented related to the anatomy of this particular human being. So, from our undergraduate days to our postgraduate days, we study the anatomy in depth. The physiology, we know as an orthopedic surgeon, I know what exactly is bone, what is muscle, what is ligaments, so what is arteries and nerves which control the bones and joints. So, physiology we do understand. Pathological basis of disease, what causes the problem, how the body responds to the particular disease, and the later what treatment that we are giving, whether it is physiotherapy or occupational therapy, and what is the problems which the people suffer. So, what disability do this problem cause to them. So, this I could understand, so with my knowledge of what I have learned as a professional, as an orthopedic surgeon. So, exploring the dimensions in therapies, so I started analyzing what is this musculoskeletal system, what it is going to do. So, I myself had a disease at the age maybe around 30s or 40 years when I was doing my post graduation, and then I was undergoing lot of advanced training methods. During those times I was not able to do some activities which was because of the pain in my particular joints. Then I started exploring what is this problem that I am myself suffering from. But the diagnosing a disease at a very early stage is not so easy. So, it takes lot of analysis, investigation, and the patient has to give a proper clinical history, and early diagnosis is very difficult. So, we have got to do lot of investigations. But a person who is an advanced disease, the diagnosis becomes very easy, because you have got a classical pictures to see and the doctor also can diagnose you. But unfortunately at that particular time, the labs, the disease would have advanced so much, the recovery would become much more difficult. So, even though there are therapies are there, may not give you the same amount of or same effect what we get if the diagnosis is done much earlier. So, as an orthopedic surgeon, so even though I was suffering from these particular joint pains and lot of problems, and I myself could analyze my own problem. So, it was very difficult. We started off with a therapy. So, I had a spondyloarthropathy, which is an autoimmune disorder. For diagnosing itself, I took so many years to diagnose it, because it was giving in a very early stage different symptoms. Then I started the drugs by a rheumatologist. So, he could just control the whole disease to particular extent. but still the disease was not totally controlled. So, I was having the waxing and waning, it was just going up and down depending on my diet, depending on my activities, depending on the diurnal variations, depending on the weather of the environment. So, these changes used to happen. Then as an allopathic doctor, I thought it is not just only the medicine which are curing, there is something extra which we do not know. Then I started exploring what other things are there in our therapy. So, I started searching or going to the Ayurveda Medical College and see what they are doing, what extra they know which we do not know. I then started practicing yoga, especially I went to the art of living and tried to now develop or pick up something which was yogic methods which they used to follow, stretching exercises, yoga postures, pranayams and meditation they used to do, and this used to give me a little bit of extra solace to me, but it was not completely curable. Of course, then I knew that it is not a curable disease, but it is definitely a controllable disease. Then I just came in with the IWSP. So, especially Dr. Sharma used to teach us lot of things related to diet and its effects on autoimmune disorders, diet and its effects on the inflammation in the body. So, all these added things added on to myself and then experimented on that and then say, of course, this is the one which is going to give me the proper relief. It is not just only relief. So, diseases which are to be there for the whole life, they need to be controlled. So, they cannot be cured. But how do we control it? So, this control of a chronic disease becomes a long-standing everyday activity. So, that is why we should have a control, and this made me to integrate multiple systems into one particular unit. I thought even my own patients whom I teach, I try to integrate all this. I try to tell them the yoga therapy postures, use of diet. So, I added on, since I have myself experienced, then I start teaching the patients. Now, we will just try to see what I have understood. I try to give you some things what I know related to these chronic disorders. It is very easy to treat a acute disease, but chronic disease needs lot of intervention, lot of modifications. So, lot of psychological support, even the mind also has to be in a very calm position to maintain that disease in a remission. So, the integration of different methods of management becomes an integral part of any treatment. So, this will actually protect the diseased tissue. It promotes the normal healing of a diseased organ. So, not for allowing any further deterioration. So, it will also, the disease keeps on progressing. As the days go, as the age advances, disease also will advance. So, it has to be kept in a controllable or sustainable level. So, maintain the health and wellness. So, one particular organ if it becomes disease, even the other organs like the mind, the tissues, the heart. So, if you just see something very painful, even the heart also will start pumping. That means we got to have a control of that particular disease to have a wellness in other organs also. So, that is why integration and controlling a disease becomes a very important part of our life. So, remedies, common disorders, musculoskeletal disorders we try to integrate. So, started formatting my simple ways of explaining. So, I started explaining why our elderly people, our previous generation never used to have these kind of musculoskeletal disorders. Of course, they used to have a lot of infective disorders. So, they used to have the diseases which are not curable, which would take their life suddenly, but they never used to suffer this chronic disorder. So, what made them not to suffer? Why we people are suffering diseases which is chronic in nature? So, this started formatting my own simple ways, what they were doing which we are not doing. So, what made them not to suffer, one which we are suffering. So, I started explaining to them because they were doing this and we do not have all that. Say for example, so some things like activities in the home. So, churning the curd or just hammering or taking out the grains. So, all those activities used to have a lot of strength to the upper limb, but now we do not have. So, machineries have replaced them. But how do I do it as a normal simple analysis which we have in our own home using simple methods? I am going to teach you a few things which are more useful. We can understand why our elders never used to have this chronic disease and why we are having it, and how to live with it without much problem using the simple homemade remedies. and all this will enhance our health in a simple home therapies. So, done using at home itself. So, you can practice it and then try to be in a healthy condition. So, how does the posture affect our conditions? Like what I have already discussed with you, what all conditions. If you are just sitting on a chair like this, working on the table or a laptop. So, how is the ankle? Just notice how is the ankle placed. The ankle is flexed for bendwards, it has bent downwards. That means heel is above the ground. So, what has happened? The heel cord and the post behind has become shortened. So, that is the one which causes this foot pain and the heel pain. Now, if you just see the knee joint, so knee joint has bent, always you are bending. Now, structures in the front have become stretched, structure in the behind has become tight. So, once you stand up from this position, sitting like this for hours together and suddenly you stand up, what is going to happen? The structures which are behind or hamstrings have become tight. So, whereas the quadriceps which is overstretched has become weak. Any structure which is overstretched becomes weak, and few steps you will stumble, and then once the tone up increases back, then you will be able to move forward. So, knee pain is a very common condition which we are going to discuss later. This posture of bending forward and sitting in a chair, again it leads to the posture of lower back pain. Then sitting like this with a crouched forward and then doing the work like that. So, where the posterior structures, behind structures are all stretched, the front structures are always contracted. Now, these structures become tight, these structures become overstretched. Again, when you start working or you want to take out something, suddenly you experience a pain. Of course, the neck pain, again you are bending forward all the time and stooping forward, hours together we will be sitting like that. We never stretch it backwards. Now, how do we maintain that stretch? How do we maintain the activity? We have got to sit like this. It does not mean that you do not sit like this. We have got to sit. How do we improve the postures in a better posture which we can live for a very longer time. Now, sitting like that and working on the mouse, so that will also lead to the wrist pain and the elbow pain that we normally see. So, posture also has got a major effect on the common conditions that we see in orthopedic OPD. So, objective of this whole talk is for you to create information. So, I will be giving you information related to the very brief information, anatomy, physiology, structural conditions, so that you have a little basic knowledge about what we are suffering, what is the structure which is suffering, what exactly is happening, and then propose some kind of modifications, some stretchable condition. Very simple thing, you do not have to go anywhere else, you can do it yourself, it is possible. Of course, I do not recommend that everybody do it, you can try in the initial phases, and if you feel that you are happy with it, you can go ahead. And only when you know, so many times what will happen when the patient comes with a chronic disease, most important aspect is you should be able to understand what he is suffering from, why he is suffering. Is it a completely curable disease, or is it a disease which has to be sustained for, or is it a disease which he is suffering from, is going to be there and it is going to take his life. How long am I going to suffer because of this disease? So, these 4 points if they are able to understand, then you will be able to sustain with that particular disease. Many people who are suffering from these chronic disorders, why they suffer is because they do not understand. Everybody wants a total cure for whatever they suffer from, but it is not possible. But fortunately for our nature, how the nature has made us, most of the disease, 60% of the disease which the human being is suffering from is self-curable, self-limiting. It will disappear by itself, whether you treat it or do not treat it. So, there is one small dictum that is there. So, if I treat a disease or a cold for example, so if I take a tablet for cold, so it will vanish within 1 week. But if I do not take a treatment in the cold, if I do not treat it, so it will take 7 days. But that is not the meaning, both are same. So, it is a self-limiting disease that we are suffering from. So, fortunately, most of the disease which we are suffering from are self-limiting. But there are few conditions which are totally curable, like an infections or trauma, injury. So, these are all totally curable without any problem, but they have to be treated. Tuberculosis for example, leprosy for example, fractures for example. So, they have to be managed, but once you manage it properly, it is totally cured. You do not have any sequelae left over. There are another disease groups which we are going to discuss here is the chronic diseases like autoimmune diseases or diabetes, hypertension or the asthma, allergies. So, these are diseases which are going to be living with us and we have to make them as our friends. How do we make friendship? We have to know more about him. Only when we know more about him, he becomes a much closer friend. So, if you want to live with him, you should know more about him. Even if you want to live with your spouse, you should know more about your spouse. So, then that integration of the two people will happen. So, this is the problem, this is the condition which is you are going to live with. That is why you should understand, you should not be scared about it. That is what happens. If this disease is going to live with me, okay, let him live with it. How do I live with it? You should understand how to live with it. Only then you will be able to sustain it. Then, because everybody wants a total cure. So, these are the conditions which are not going to have a total cure. So, you are going to live it. So, once you understand that I am going to be here, then your mind becomes quite calm. You will not search for a person or a therapy or a pati who falsely tells you, you take this, I will totally cure it. It is not possible. Like rheumatological disorders, if it is something which is going to be there with you, you should know how to live with that particular problem. So, to living with that particular problem, you have multidisciplinary approach. So, drugs are there, the therapy is there, yoga is there, meditation is, all of them will add on to keep that disease in a proper way. The last group of diseases are there which whatever we do, it is only palliative. Disease is going to progress whether you treat or do not treat it. What is the purpose of treating in such condition? It is only to reduce the speed of development of that particular disease. So, for that we just reduce the speed. Management of such disease is only to lessen the speed or to prolong the life, so that for a comfortable life. So, that is a palliative care which is there, that is the end, which is going to take your life. If you know it before only, then you will enjoy that, even that small duration of the condition which you are suffering from. But if you do not understand and you always want a total cure, you just keep on searching for multiple sources for total cure, and where you never get it, and you become depressed and you become dull. So, life will become a horrible horror it is. So, we will see only how to conditions which are chronic in nature, why they arise. So, how do we do it, how do we live with it, or how do we do something so that it does not recur again and again. So, that is the purpose of this whole talk which we are going to discuss. So, we are covering in the future sessions some common conditions which this musculoskeletal system give it to you, like the pain in the sole. So, it is called a plantar fasciitis or a retrocalcaneal bursitis or the heel pain, osteoarthritis of the knee joint like a knee pain of elderly or even younger age group, lower back pain in the elderly and younger age group, cervical spondylosis or the neck pain which more commonly seen especially in the software engineers, the shoulder stiffness especially very commonly seen in diabetics, the tennis elbow, again diabetics, the elbow pain, that is what is called elbow, decurvent stenosis, the common conditions around the wrist joint, and some few points related to the autoimmune disorders or inflammatory arthropathies like rheumatoid arthritis and ankylosing spondylitis.